Alberta Screening and Prevention, or ASaP as many of us know it, is a provincial initiative that HealthQuest has created a template for us to use. This will contain all of the screening maneuvers that are included in the ASaP program. So if a patient does not have an ASaP template on their chart, we will find it in the medical history section here. So what we can do is we can click on New under the chart notes. Then we'll select ASaP and click OK. And then the ASaP template will populate. And then any fields that would auto-populate will do so at that moment. So then if we save it and go back to the overview, you can now see that it is now situated in the medical history. This template is only allowed on a patient's chart once, so it is a template that you would maintain and update as you go. It is not one that you would create a new template every time. This is good because it allows all clinic staff and clinicians to use the same template and work off the same template and give the patient the same relevant information around these screening maneuvers. So what we can do is if we hit the Control and right click on this ASaP template, it's going to open this in a secondary window, and I will move it over to the right hand side here, and then I can open up my new chart notes for today's visit. So this can be used by all members, like I say. So the clinic front staff may be taking vitals when the patient arrives. They would enter it into a chart note that would then pre-populate into the ASaP template here. They may also supply the patient with a lifestyle questionnaire that can be completed that includes exercise, tobacco, alcohol, and influenza. They can then update this ASaP screening template with the information the patient has completed on the lifestyle questionnaire. Multidisciplinary team members can also use this template as part of their visits with patients, whether that is to help with education, whether it is to view results with patients, or to advise them that they are coming up due for one of these screening tests, and they could then share one of the requisitions that is applicable. The physicians can then obviously use this as well, and most of this potentially could be completed before the patient even reaches the physician. So then the physician can then just use this template as a summary on the side while they complete their today's chart note and then update with the patient. This template can also be used by the patient themselves. It's very clear in terms of what the screening maneuvers are, the age intervals that they should be starting the screening, and how often they should be screened for. And with some physician guidance, you can see that there is the completion date of these tests on the right-hand side. And then in the left-hand side along the column there, you can see when the test is next due. So this would be a perfect handout for a patient. If you were to print this template, the patient can then play a role in their preventative care and schedule appointments based on when tests are coming up due as well.